These are hip circles. So whatever hip I'm working on is going to go back with that leg straight, and I want most of my weight on this leg. I'm going to put my finger right where my hip joint actually is. So that'd be the crease of my hip if I was going to go through flexion here. I'm going to drive that leg back, and now what I imagine, I'm going to kind of come on an angle here, is I'm going to draw a box with my hip to start. So I'm going to knock my hip in, back, out, and forward. And now as I keep going through, because we're going to do about 10 each direction, I'm going to start to connect those dots and make it a little more circular as I go. We'll do 10 one direction, switch directions, 10 the other way. Now we're going to do that in a split stance. So again, whatever leg I'm working on is straight. So now I'm going to get my finger right on my hip joint so I have some feedback here. I'm going to draw my box again. So in, back, out, forward. As I go, I start to connect those. Some really common mistakes with this one is a lot of pelvic movement. So it's not a hula hoop motion. We want to imagine my hip joint is a mortar and pestle, and I'm spinning through that joint. The other one that's a big mistake here is a lot of anterior pelvic tilt as we move around the hip, which is going to close off some flexion of the hip here. So what we want to make sure is we're pretty neutral, which may feel like we've got a little glute activity. And if we watch down the line, we're not seeing a major dump in the anterior tilt. And those are our hip circles.